Oh, so the study that we are presenting at this meeting is a trial that we conducted in Mexico, looking at mutations in the dihydropyrimidine gene, dihydropyrimidine mutation, in people with gastrointestinal malignancies. And the reason why we did this is because most panels looking at these mutations, which increase the risk for toxicities associated with fluoropyrimidines, are done in Europe or in the United States. And so genetic backgrounds of other places, such as Latin America, are underrepresented. So we need to understand what's the prevalence of these mutations in other places of the world to figure out if we need to implement strategies to detect this early and avoid potentially life-threatening toxicities. So for this study, we enrolled 200 consecutive patients with gastrointestinal malignancies who were candidates for receiving treatment with dihydropyrimidines. We obtained a sample, a blood sample, before starting treatment, and then we did a panel with a wide panel of DPD mutations in collaboration with the National Institute of Genomics in Mexico. And then we assessed whether patients had grade 3 or higher toxicity when they were started on fluoropyrimidines. And we assessed this longitudinally over 6 months. So what we found was actually very interesting, and it was that the prevalence of these mutations was very low in the Mexican population. Only 3 patients out of the almost 200 patients we recruited had any mutation that was risky for toxicities. And this is much lower than what has been found in other populations, like European populations, where you have 5 or even 10% DPD mutations. So what this shows is that the current panels and the current recommendations that we have are based on populations that are not exactly the ones that we studied. So this sets the stage for future research looking into specific mutations which may be more common in Latin America and which we may need to test for if we want to implement this in these countries and in these regions. Well, I think the implications are broad. Many countries in the world are not testing for this before starting treatments with fluoropyrimidines. And this can be tragic because if you have a patient with these mutations and you treat them with these medications, then they can have very severe toxicities that even may lead to death. So, for example, in Europe, it is by law that countries have to test for this before starting treatment. In other places, including the US, this is not done routinely. And in Latin America, some countries are starting to implement this, but what our study shows is that if we use the panels that are designed for use in Europe, we just won't find anybody. So we have to find what the mutations are so that we can create the right panels for the right population. Now, I would like to thank the American Gastroenterological Association, which funded this study through a disparities grant that was sent to us last year. And this was very important because it was the first time one of these grants was given for research outside of the United States. So that I would like to acknowledge their support.